Good afternoon, everyone. Welcome to today's webinar from URAC. We're going to cover mental health parity and why it's such a vital element in healthcare. We know there's some recent regulations that have just come out, and we're looking at how regulations are being reinforced now. It's always good to see people, so please introduce yourself in the chat box. We know some of you are familiar URAC faces. Staff should do so as well. We take all of our questions in the chat throughout. So my name is Lisa Silverman. I am URAC's Client Education Specialist. It's great to be here with all of you today. Quick look at our agenda for today. We're going to give you a little bit of an overview about URAC, just for those of you who may be new to URAC. We're going to talk to you about the 2022 Parity report that just came out from some of the combined agencies. We're going to show you a little bit about URAC's ParityManager and talk a little bit about our Parity Accreditation program. And then you'll see we have a star here for remaining questions, but really our style is to answer your questions throughout the webinar. We don't want you to get stuck on something and have to wait 30 or 40 minutes for the answer. So please, at any time, chime your questions into the chat box. If we can't answer a question on the spot, we'll get back to you. We're pretty good about following up within about 48 hours. I'm joined by the URAC Dream Team here today. As you can see on the slide, we've got Deanna Hardin, who is our initiative lead for mental health parity. She's going to be your main and first point of contact for anything related to parity if you're just getting started with URAC. Then we'll be joined by Kevin Malone. He's a senior counsel with Epstein Becker Green here in Washington, D.C. And he is the parity guy. We go to him. He knows the parity stuff. He's a wealth of information. Alessia Lamb is our senior application support specialist. She works specifically on our ParityManager program. She is working directly with our software solution. We've got Karen Watts, who's our vice president for accrediting and client services. She's here to tell you a little bit more about our accreditation process. And like you see, my face is on the screen, Lisa Silverman. Deanna, the floor is yours.
So, hey everyone, I was really happy to see that I know quite a few of you from the registration list. So good afternoon. For those of you who don't know me, I am Deanna Hardin. I'm the initiative lead for mental health parity compliance program and health plan accreditation here at URAC. And so for those of you who are not familiar with URAC, I'm going to tell you a little bit about who we are. So next slide. So URAC, we are an independent accreditor. We've been around for more than 30 years, and we do not provide consulting services. We do have 40 plus accreditation programs, some of which that are listed below, ranging from Health Network to and Medicaid, so all different things. Can you show the next slide, Lisa? So on this slide, it shows an overview of our programs. Of course, we're focusing today on mental health, substance use disorder parity, and this just shows an overview of our programs. And we do provide resources and tools in which my colleague, Dr. Watts, will touch on later in the webinar. And I'll be back in a bit to touch on the main functions and the overview of the compliance program that we have for parity after Kevin speaks on the report to Congress.
Thank you very much, Deanna. It's nice to see everybody. As I was introduced, I'm Kevin Malone. I'm an attorney at Epstein Becker and Green in the healthcare and life sciences practice in Washington, D.C., and I'm a consultant to URAC in support of the Parity Accreditation program. If we can go to the next slide, Lisa. So my goal for today is to just catch everybody up on a lot of the recent developments in parity that I'm sure for those of you who work at health plans, you're very familiar with. But it's been a really big year and a half for parity. And when we talk about parity, it's part of a long history. As you can see here, what the sort of federal approach to regulating mental health benefit design through the concept of anti-discrimination goes all the way back to 1996. But what we're talking about in the Mental Health Parity and Addiction Equity Act, that really was passed back in 2008 and expanded through the Affordable Care Act. And what really has changed the game entirely and is the focus of our conversation today is the Consolidated Appropriations Act, which was passed in December of 2020. Next slide. And the Consolidated Appropriations Act is really what has fundamentally changed the way parity compliance works in the marketplace. So even though many of the requirements that were included in the Consolidated Appropriations Act had been issued as sub-regulatory guidance, FAQs, self-compliance tools, et cetera, from the Department of Labor and other federal regulators, the Consolidated Appropriations Act actually baked it into the statute itself and totally changed the game for oversight. And so it basically took the requirements related to managed care activities, meaning anything that the law refers to as a non-quantitative treatment limit, and imposed a new obligation that every health plan in the country that wants to use some form of non-quantitative treatment limit on mental health or substance use disorder benefits has to have a compliance analysis performed in advance that proves that that NQTL is not discriminatory. And so the structure of that analysis is described in the statute and in some FAQs, and the Department of Labor did a lot of auditing and oversight activity related to these analyses in 2021. And the report to Congress that was issued last month really was the reflection of the sort of summary of all of their activities during 2021 in implementing this new oversight requirement. The report to Congress is going to, in the future, include the names of health plans that the Department of Labor has determined in a final determination to be non-compliant, but they didn't include anyone's name in the report this year because they haven't issued any actual permanent final determinations. They've made a number of initial determinations, but they've kept their powder dry with regards to the actual naming and shaming that they have the authority to do. Next slide. So just to highlight a few of the really key findings that sort of frame the new enforcement landscape for parity. First is that in the department's audits of many hundreds of NQTLs in 2021, their report indicates that none of them met their expectations as to proof of non-discrimination. And there's a lot of different ways to interpret this, but I think from our perspective, the key takeaway here is that the Department of Labor's expectations around a comparative analysis that proves the negative, that there is no discriminatory activity, is hard to do. And that having something that meets... Sorry, Maggie, I think you're coming through.
We knew they weren't in the right pocket.
Sorry, is anybody else hearing anything? Okay, there we go. So I think the key takeaway here is that the comparative analysis is very difficult. Having all of the elements that satisfy DOL's expectations are very complicated, and that they really are still honing their expectations as to what is necessary. If you've seen any of the criticism letters or the initial determinations of non-compliance, it's clear that they're still working out some of the details around what they consider to be an adequate proof document of the absence of discrimination. They did issue a number of initial determinations of non-compliance, and CMS did as well, using the same methodology. And as I noted, there have not been any issuances of final determination letters. But once they get there, those plans will have to notify all of their beneficiaries that they have received such a notice, effectively telling everybody, we have been found non-compliant with parity. And of course, that's not something that anybody wants to be sending to their members. A really important takeaway for 2022, though, is that the departments will be issuing new proposed rules, so at least they've indicated an intent to, this year. So it's definitely going to be an active year for further guidance, further refinement from the departments. Next slide. So it's, in addition to their work on regulation, we expect that the oversight activity that we saw in 2021 will continue at the same pace in 2022. And that's really because they made significant investments in staffing and training in parity. Many of the regional offices for the Department of Labor have sort of hired new people specifically dedicated to parity oversight. And they've done a lot of training internally within the departments, both at CMS and at DOL. in building out their capacity to do these audits. And they indicated in the report that they really focused in 2021 on plans that they either had a complaint related to, or even more commonly, that they were already doing an audit anyway with that plan, and they just sort of added Parity to the list of things that they were asking for in the exam. But I think we can expect the plans that have not been previously subject to those exams getting pulled in 2022. Next slide. So with regards to NQTLs, we talked about that at the beginning. This isn't a webinar, it's sort of at the 101 level about what NQTLs are, but to quickly catch everybody up, an NQTL, or a non-quantitative treatment limit, is any activity that's not quantitative in nature that constitutes a limit on the scope or duration of benefits. And the way to think about this is that if you take, I actually do it by dint of exclusion. So if you take things like annual and lifetime dollar limits, cost sharing, or hard quantitative limits that are baked into your evidence of coverage or your summary of benefits, take those things off, those are not NQTLs. Everything else that you do as a managed care company is an NQTL, because the department has basically issued over the years continuously expansive interpretations of what constitutes an NQTL. So medical necessity criteria, even the development of the criteria itself, that's an NQTL. Of course, everything related to utilization management, prior auth, concurrent review, that's all NQTL land. Retrospective review activity, including fraud, waste, and abuse audits, all NQTLs. And sort of most controversially, everything that you do related to the management of the network, including provider reimbursement methodologies, out-of-network provider reimbursement methodologies, credentialing, contracting, and recruitment. We have self-imposed network adequacy standards. All of those things are considered NQTLs in the eyes of the regulator, in the sense that they have an indirect impact on the scope of benefits for enrollees in the plan. And as a result, once that label is affixed to it, NQTL label tagged, the requirements for the comparative analysis attach. And what that means is that there's now a rebuttable presumption that that activity is discriminatory, and that the comparability and stringency analysis has to be prepared to prove on request at any time that that activity is not discriminatory. And so that's really the framework in question here. The Department of Labor did narrow the scope in their initial FAQs after the Consolidated Appropriations Act to 4 NQTLs. But as you can see in the report to Congress, it's clear that they actually investigated a lot more. And that many of the other ones were actually instances where they found active discrimination. So this is one of the most important takeaways from the report, which is that they found non-compliance on all these NQTLs that they started out looking for, the 4 related to prior auth, concurrent review, out-of-network provider reimbursement, and in-network contracting and reimbursement. But you'll note that the findings that they had for those NQTLs was that the comparability and stringency analysis was inadequate. It's not that they found that those activities were actively discriminatory. And so we draw a distinction between things that are affirmatively discriminatory and where the comparative analysis doesn't prove that it's not. And so all of those NQTLs, 4, they were sort of rampant problems with proving the lack of discrimination. It was in the other things that they found in the summary of benefits and in the benefit design and coverage materials related to exclusions in particular, where they found active things that they considered to be actively discriminatory. And that's where you see the long list of NQTLs that sort of pop out in the DOL report. And those came just from them rooting around in the plan documents as they were going through the audit. So plans really got in trouble in both directions. One were sort of these random exclusion criteria that they use just for behavioral health conditions that constitute NQTLs that failed to pass the test. And the DOL said, those are actively discriminatory. But the vast majority of their time, effort, and oversight was on instances where they didn't come to a conclusion that it was actively discriminatory. They just said, you failed to prove in our rubric that it's not discriminatory. And so the way we think about parity compliance in the era of the Consolidated Appropriations Act is you actually have to be prepared to do both at all times. Actually identify and eliminate things that the DOL will consider to be actively discriminatory, and ensure that you have these proof documents available in the rubric that the departments request that establish in their eyes that everything you do is not discriminatory. And so we'll talk about how URAC's products can help you achieve both of those goals as we go forward. Next slide.
Kevin, before you go into that next slide, let's talk about who are these audits coming from? Are they coming at the federal level and the state level? And which agencies are we seeing coming in to do it? Is it Health and Human Services? Is it labor? Is it insurance? Who is it? And who do we kind of need to be on the lookout for when they're,
Sure.
proverbially knocking on our doors?
Yeah, it's a great question, Lisa. So parity, to step back, think about what the parity law applies to. So parity as a statute applies to every insurance market in the country except for a few carve-outs, which are important ones, but it doesn't apply to Medicare and it doesn't apply to Medicaid fee-for-service, so state-administered Medicaid programs. But it applies to the entire self-funded group health plan market, the entire fully insured market, the exchange, individual, and marketplace plans, and Medicaid managed care. So like with those, it applies to almost everything in the market. It also applies to state employees and local government plans. It applies basically to everything that you can think of other than Medicare and Medicaid fee-for-service. Even OPM has indicated that they're going to be applying it to FEHB. So it's coming for almost everybody. And however, there's not a single regulatory authority that sort of can reach its arm into every different market. Parity applies through the existing regulatory oversight in each of those markets. So what that means, to answer your question, Lisa, is that state departments of insurance are doing significant market conduct exam and audit work on parity. Even some state attorneys general are rolling up their sleeves and taking aggressive lines related to parity, even if they don't really have authority under the insurance code to do that. Many of them are doing it anyway. Medicaid agencies are doing their own audits and investigations. CSIO, or the branch of CMS that's responsible for the marketplace plans, they're doing extensive auditing both of marketplace plans and of a number of what's called direct enforcement states. But the biggest enforcer on the block right now is the Federal Department of Labor. And they are going after both employer self-funded group health plans, their fully insured commercial issuers that they work with, and their third-party administrators. I think a big takeaway for me in 2021 is that DOL knows that NQTLs are the primary responsibility of the issuer or TPA. And they are not entirely letting employers off the hook for the analyses, but they understand that the TPA and the issuer actually have the information and are running the policy as the subject of those NQTLs, and they're focusing their analyses accordingly. So you'll see if many TPAs or issuers will be getting parallel audits from the Department of Labor in their role as the TPA for multiple employers. They'll be doing multiple concurrently. And in their role as a large group issuer, they'll be getting, in some cases, 3 or 4 DOL audits at the same time for parity. So I think prior to 2021, states were probably the most active enforcers in a sort of patchwork based on state self-developed parity statutes that in many cases even go beyond what the federal parity law requires. But after the Consolidated Appropriations Act, DOL and CMS, particularly in the Biden administration, have really stepped into the front of the line in the enforcement train.
Kevin, thanks for addressing that. I think it's so important to hear that, it's not just a federal something and it's not just a state thing. And I know you've told me there are some states where they're looking at it and they are not going easy, and we just need to be prepared. I mean, thankfully, we're going to hear a little bit from our team about how URAC has programs to help prepare. But Kevin, let's talk about some of those types of corrective actions here.
Yeah, that's a great question. So I think, of course, the types of penalties and sanctions that we're seeing vary a lot by the type of conduct and in the response, as well as the regulator. But when we're talking about the report to Congress, which was specific to the federal tri-agencies, HHS, Treasury, and the Department of Labor, they're really focused on the corrective actions that the federal government imposed in 2021. And those include retroactive reprocessing of any denials of claims that were on the basis of exclusions that they found to be invalid under parity. They also have required the notification or sort of issuance of errata of plan documents to clarify that certain things are covered going forward. And they've made for significant amendments to medical and analytic policies. A big part of the corrective action process so far has been making everybody who failed in their comparability and stringency analyses redo them. And in some cases, that requires actually stepping back and going to the drawing board and saying, wait, why do we do this activity? Like, why do we do prior authorization for some services and not others? We now realize we have to document our decision making because Parity cares about why we do things, not just what we do. And so these are the sorts of things that DOL is getting into the weeds with health plans on in a way that's a total expansion of the scope of what they care about as a market regulator. They went from sort of looking at sort of basic adjudication of benefits to now really getting into the weeds of why managed care organizations do certain functions that have historically been a part of their professional judgment. And so it's a real it is a real turning point in the way the federal government is approaching the regulation of managed care, and I think we should see it that way.
Kevin, I'm looking before you go off screen. I'm looking at some of these things, and I can just see if I'm a health plan, that's a lot of work to have to go back and redo some of these things. So I'm really happy that Deanna and Alessia are going to come out and they're going to talk about some of the tools, which hopefully can actually save health plans that time from having, I mean, how many human hours go into re-adjudicating or paying claims that were denied? How many hours of training go into this? And thinking about the number of hours have already been put in, and then that number of hours that would still have to come.
Yep. It's a big undertaking for sure. And I think a key takeaway is that the agencies are staffed up and ready to ride, and they're not going to be throwing the brakes on in 2022. Certainly, they're going to be continuing to get ready as they roll out new regs, but it's definitely going to be an active year for federal parity oversight. And the last thing I will say to your point, Lisa, about state activity is that you have seen that the federal efforts have in some ways shamed some states that have not historically been active in parity oversight to get active. You know, there's been a lot of discussion around the Consolidated Appropriations Act and how the federal government has stepped in and really taken action against fully insured commercial insurers that are subject to concurrent state oversight. And that's a bad look for a lot of state departments of insurance and governors who want to be seen as protecting residents of their state from discrimination. And it's an easy target. And so I predict that a number of states that will be looking for opportunities to increase their own enforcement in 2022, in some ways to not be outshone by the efforts of the federal government in 2021.
Kevin, thanks so much for that. You're going to head into the chat box for a little bit in case there are any questions there. We'll bring you back in just a couple of minutes. Deanna and Alessia are going to come on to talk a little bit about URAC specific programs that we use, that we have, our software, our solutions to support our clients here. So Deanna, you're on camera. Alessia, get ready. You're up next.
Yeah, thanks so much, Lisa. So in effort to kind of piggyback off what Kevin was saying, Lisa, can you go to the next slide? In effort to support what he's saying, our goal is to allow organizations to prepare for potentially a parity audit. So I really wanted to just break down the components of our parity program. So you'll see on this slide our suite of mental health and substance use disorder parity solutions. So it's kind of a three-component process, and I like to use process because the end game is to ultimately pursue full parity accreditation. But just to be clear, the compliance guide can be purchased. It's simply just a guide, and I don't say just to downplay it, but it lists out statutes and things like that, so you don't have to scour the internet to find laws that have been out there for years. It's kind of just right there for you. And so the middle portion, ParityManager, that is our cloud-based software that we're coming to kind of focus on today. And that is something that I really want to make clear that organizations can use as a standalone feature. Regardless if you're ready to pursue Parity accreditation, you guys can utilize ParityManager software, enterprise level, it's cloud-based, without pursuing accreditation if you're not ready to do so and can choose to do that at a later time. So that's a really important little piece of information that we find valuable that I wanted to get out there. And so on ParityManager, we really like to showcase the ability for, this is just like a documentation management housing system. It streamlines the process. It has the standards listed there. It organizes everything. And at the end of the day, shall you get a parity audit, you have the ability to print out reports that are in an organized structure to hand over. And ultimately, like I said, just to keep it kind of simple, if you're not ready to pursue accreditation in Parity, you can utilize the software, get everything ready, choose to do that later, and you would go through a full application for accreditation. And shall you be awarded, you would get a seal, and we would showcase and celebrate that commitment with you all. So that is the end game, but I really wanted to touch on ParityManager being that you can use it as a standalone function until you're ready to move on to accreditation, shall you decide to do so. And then some of the functions that we've found that have been really useful to highlight in ParityManager that Alessia will touch on is basically just what Kevin was saying. It's creating a framework to house these documentations and analysis and identify these classification benefits on NQTLs and QTLs, and again, provide and generate feedback and analysis and reporting system. So at this time, I'll hand it over to Alessia, and she'll be able to dive in a little more on those key features and functions of ParityManager.
Thanks, Deanna.
Thanks.
Alessia, you're on mute, and that's how webinars work. So
thank you so much, Deanna and Lisa. Can you hear me?
yes.
Okay, great. Thank you so much to both of you. Good afternoon and welcome. My name is Alessia Lam. I'm a Senior Application Support Specialist on the URAC's IT team. And today we would like to highlight a few of the features that ParityManager offers. The first one is the Document Manager. The Document Manager provides an organized system to store and manage all your supporting operational documents necessary to facilitate Parity compliance. When working on their Parity submission, users can upload their supporting documentation using the Document Manager feature. Uploading a document is easy. All you do is simply choose a file by clicking on the shaded area or drag it there. And then the uploaded file will show on the left under File. And then click on the appropriate file name on the left, and then click Attach File to attach a file to your response. Any document uploaded by a user to the system gets added to a library of files in ParityManager. Then all users associated with an organization can easily access all of the files uploaded by any user from their organization through the Document Manager feature. This makes it very easy for teams to collaborate on data entry because they have access to this shared library of documents through the Document Manager. There are no restrictions to the types of files that can be uploaded, and every file has to be uploaded only once. If users want to attach the same file to multiple response sections, the Document Manager allows them to easily access the entire library of files uploaded to the system. The Document Manager also has the search functionality, which enables users to quickly locate a file by searching the library of all the uploaded files in the system. Next slide, please, Lisa. Thank you. The second feature that we would like to highlight today is the ability to copy product lines. The user designated by an organization as the team owner or the team lead has permissions to duplicate a product line, which copies all of the information and documents from an existing product line into a new one. This helps save time on manual data entry. To copy a product line, you would simply select the appropriate product line on the dashboard and then click the copy icon. And with one click of a button, a user would be able to duplicate a product line, which again carries over all of the previous information and documentation from an existing product line into a new one. And the copying of a product line allows ParityManager users to complete a product line and then use it as the starting point for others that have the same approach on NQTLs. For example, users can complete a product line for Medicaid and for commercial, and then use one for each of those as the foundation to avoid needing to do repeat data entry. Next slide, please. We would also like to tell you about the ParityManager report, which is another critical feature of the ParityManager application. All users have the ability to download the ParityManager report and the supporting documentation associated with their product line. The ParityManager report is a PDF export of all the responses to the questionnaire and the comparative analysis sections provided in the system. One of the great features about the ParityManager report is that it shows a count of parity flags or potential parity violations that the system automatically identifies for the applicable questionnaires based on the user responses in the system. The report also shows which questionnaires are missing information, as shown in this example screenshot here. This allows users to quickly identify which response areas still remain incomplete as they're working on their submission in the system. And now, Kevin, could you please tell us a little bit about how these features help organizations maintain compliance?
Absolutely. Thanks, Alessia. So as I discussed before, the Department of Labor's approach in many states are mirroring the same format, really calls for the development of these proof documents to establish that NQTLs are not discriminatory. And the departments are very formulaic in the structure of describing what each NQTL is, which benefits it applies to, the factors considered and whether or not and how to apply it, the definition of those factors, a comparative analysis of those factors in writing, identification of operations measures. Each of those things is a very structured data element that the departments are expecting to see in the comparative analysis. And they want to see a real neat and clean narrative conclusion that walks through each of those factual elements and explains why they are not discriminatory. And ParityManager is designed specifically to help collect and maintain all the information necessary to construct those comparative analyses in a tight and clean way. And so that it's both very precise to the reader of what the information is and the comparative analysis and the proof that it's not discriminatory. And that once it's uploaded, it's very easy to update because all of the information that we're talking about is policy. It's your strategic decisions of how you manage the benefits. And those things can and should be able to change. Parity doesn't say that things have to be locked in stone. And so ParityManager is designed to both facilitate the collection and maintenance of that information, including updating it over time, so that you are confident that if you get audited, you can produce a ParityManager report on command that will prove that you're complying with parity in exactly the structured format that the departments are looking for.
Kevin and Alessia, thank you so much. You both are going to head back into the chat box, and I'm going to ask Dr. Karen Watts to come on screen and talk to us about Parity Accreditation.
Excellent. Hello, everyone. And thank you, Lisa. As Lisa said, I am Dr. Karen Watts. I am the Vice President of Credit and Client Services. And it's my honor to be here to discuss what it is that we do here at URAC and why accreditation is seen as so important and helpful to organizations as we go through. Next slide, please, Lisa. So we have roughly over 1,100 clients and applicants going through accreditation at any given time. And we've had several clients who have always told us that as they went through the accreditation process, one of the things they saw is that it made them a better organization. The reason why you will see that accreditation makes them a better process is that it provides a framework that allows organizations to actually identify their quality structure. It ensures that there is a continuous ability to look at that quality structure and make any improvements as they go through. One thing about, as we've listed earlier, is that URAC is an independent third party. So what that means is that we are not regulated. We are not, no one gives us expectations about how it is that we are supposed to develop the standards and put them out. We use independent stakeholders who come together as we're looking at what's going on in the arena and put together standards that will help move and improve quality of care to patients. URAC has demonstrated leadership and initiative in growing through this field. And we've noticed that as we go, we update our policies, we update our programs to ensure that as you go through accreditation, you are going through standards that will meet the arena's expectations. Next slide, please. So let's talk a little bit about mental health parity accreditation, or I should say mental health substance use disorder accreditation. So this, what you're seeing on the slide is what we would call the focus areas for this. There's the core operations. Within the core operations, you'll see business requirements, which would include things like your PMPs. How do you comply with the laws within your state? When we talk about personnel, who's your clinical leadership? What does your leadership structure look like? And when we talk about parity compliance, we're talking about how do you describe your program? Tell us what you do. And then how do you also look at parity violations, and then how do you ensure that you are now meeting a non-parity? It's non-parity. There are not any parity violations being seen. When we go into standards, so that's standards 1, 2, and 3. Now, when we go into standards 4 and 5, this looks at your benefit equity. We look at your annual lifetime dollar limit. It allows you to tell us what that is if you do have those things. And then when you look at number 5, this allows you to actually identify your benefits structure. So whether it is inpatient, outpatient, your emergency, you're going to tell us what it is that your benefit structure is. We have a separation, whether it is a Medicaid, or a non-Medicaid health plan. When we talk about financial and quantitative, we're looking at financial requirements. And then we're also looking at quantitative treatment limits. So any imposed financial requirements, all that will go into this section. And then we move into NQTLs, or the non-quantitative treatment limits. This fills out the standards 7, 8, and 9. Under 8, 9, and 10. So when we talk about the identification of NQTLs, you're actually telling us what NQTLs you may have there. Your comparative analysis allows us to know and see how you are handling, as written, those imposed NQTLs on medical, surgical. And then also the comparative analysis in operation allows us to see the organization to explain how the operations of the NQTL is imposed on mental health and substance use disorder, and the steps taken to ensure comparability, and that there are no more stricter than, the NQTL is no more stricter than it is for med-surg. And then 1113 rounds out the rest of the application when you're talking about, and these are all your disclosures, whether it's medical necessity, denial, or you have, you're a TPA and you're providing some information on that. Next slide, please. So let's talk a little bit about the accreditation process. Once the contract has been signed with URAC, one of the things, organizations are given a date as to when it is that they're going to upload their application. That would be their due date. Once that organization has uploaded their application, it'll go into what we call the desktop review period. Now, in the uploading of your application, you'll have a client relations manager. If you have questions, we have an interpretation line. All those resources are available. We have a client portal that you go to and ask questions or provide any additional, if you need additional information that we need to provide to you. There's an opportunity as you're going through that process. Once you submit your application, that's desktop review. This allows individuals to get an idea about whether or not you have demonstrated compliance to the standard. And the way that is done is that a lead reviewer is assigned, and that individual will go through the application. If you have demonstrated compliance to the standard, great. It's marked as met and move on. If there's an opportunity for the organization to provide additional information, what we will do is submit it, an RFI or request for information, send that application back to you for you to give us a little more information that demonstrates compliance to the standard. Once you've completed with that desktop review, you move into the validation review. On validation review, this is where we come in and say, okay, you've told us what you've done in your policies and procedures. Now let's see how well you walk the walk and talk the talk. So you have implemented your policies and procedures. We have a conversation with you. We look at files, we do file reviews. And again, we have that conversation between you to see what is actually going on. Once the validation review is finished, by the time it's done, you will know where you stand, because that lead review will let you know what standards you have met, where there's opportunities. Your application is then sent to the accreditation committee. For it to be sent to the accreditation committee that's blinded, in other words, all information regarding your organization is blinded out, so that the committee has no idea who this applicant is. All they know is it's an applicant that is seeking accreditation. Once that accreditation, and we're expecting great, it'll be full, then you fall in what we call our monitoring. Our expectations is that organizations who go through accreditation must remain compliant for the 3 years that we are giving you accreditation. Next slide, please.
And Karen,
So
I know you touched on a little bit of this already.
Yes, I
So it's
sure
exciting
did.
to see it here again.
We talked about our client relations managers. They're the first people you will meet as you come into the organization. We talked about the accreditation reviewers. Those are the individuals who are going to look at your application. I also talked on the client portal, which is a great resource for individuals going through accreditation. The one thing I didn't touch on is the program guide. Any organization who comes through for an accreditation is given a program guide for the program that they're going through. So in this case, you would be giving a program guide for mental health and substance use disorder parity accreditation. In that, it will give you demonstration, things that you need to put in for that demonstrate compliance on desktop, things that you will need to provide to us that demonstrate compliance and validation review. And then on-site tips are also provided. Next slide, please. And I'll turn it back to you, Lisa.
We are up to the question and answer portion, although we've had some questions coming in. What's on your mind at this point? What are you thinking about? Amy, I saw you put in a question here of, do organizations ever think of just doing audits for internal purposes? Kevin, I'm going to ask you to pop back on and talk to us a little bit about why an organization, if an organization might want to do that audit, and why, just to kind of maybe stay a little bit safer so that you don't quite get caught. So Kevin, if you can hop on back, that'd be great.
Sure. Yeah. So the key here is that sort of being able to be more confident in knowing how your NQTLs and your overall parity compliance program would be seen by federal and state regulators is extremely helpful in understanding what your risk areas are and knowing that you can be more confident in your ability to pass these audits and not go through very expensive rounds of back and forth with the departments and potentially very damaging public disclosures of non-compliance just because of inadequacy of comparative analysis documentation. So that's really the biggest reason.
Kevin, thanks so much. We want to entertain any other questions that we have here. We do not need to go the full time. That's not URAC style, but I want to make sure that we have anything. Kevin, let me just put one out here for you, just kind of in closing, if we see any others. You gave a lot of big takeaways today. It was really important. What's the one thing that organizations need, if you had to distill it down to just one, what's the one thing that you want people to leave this webinar with?
Just that I think the big takeaway for me is that the Mental Health Parity and Addiction Equity Act is being enforced in a way that's unlike anything that's happened prior to 2021, and that it requires really organizational and cultural change in order to be able to reduce regulatory risk. And that requires new thinking, new approaches to compliance and operational oversight. And URAC's ParityManager and accreditation products are designed to really facilitate and support you in that journey.
Kevin, Deanna, Alessia, Karen, thank you so much for being here with us today. Karen wants to chime in here.
Yes. So I noticed in the chat that there was a question in reference to doing audits for internal purposes in addition to a full accreditation. And so I thought I'd just kind of address that in case anyone else had that question in mind. So if you look at, we had an opportunity to provide you some overview on the ParityManager system itself. That allows organizations to kind of do their own internal, because you are actually putting information into the system. That same system is the same system that we would do for an accreditation. So organizations, as Deanna had said earlier, if you're not ready for the accreditation, but you are ready to use the system and want to use the system as a way to demonstrate whether or not you are parity compliant, there is that opportunity to be able to do that. And so as you go in and do that, you will be able to get the reports out, as Alessia showed to you earlier. As you went through the system, the reports will come out that will give you where there might be some violations or not. So keep that in mind when you're ready and go for the full accreditation. It will include that already portion that you have with the ParityManager.
Karen, that's why I took us back to this slide, because it really does show that
Awesome.
Our programs kind of build on each other, and you can have, you can start with compliance guide. If that's just where you are right now and you're just trying to understand as an organization what is happening here and trying to get through the, what is this? What are the regulations? What's the dictionary of this? We've got that. Then we go to ParityManager and it builds up a little bit. And then the accreditation is really that next level. That's where URAC is also looking at your business. So we're looking at your business operations in addition to just what your plan covers. So really you can see these are on a continuum and they build on another. There's a question here from Christine. She says, perhaps a provocative question. I'm a little on guard about answering provocative questions on webinars, but I'm going to go for it here. I'm wondering where parity lives in health plans. Is it an organization-wide undertaking? Is it under behavioral health? Is it compliance regulatory? And I would love to know, Karen's going to get in here. My guess is Kevin will get in here. But I'd also like to open this up to those of you in the chat. Where does parity live in your health plan? Because health plans are all different. So maybe it does live in one place. So feel free to chime your answer in to the chat of where it lives in your organization. Kevin, why don't you take it? And then Karen, you can take it.
Sure. Yeah, so I'll take the first crack here, but I think you're right, Lisa, that it does vary. But I think that it really kind of comes down to what you think you mean with regards to the word lives. So I think when we see a health plan with a robust parity compliance program, that really involves a culture that adopts parity compliance throughout the organization in the functions that are subject to parity. In the same way that you would think about HIPAA compliance is something that everyone in the organization has some situational awareness of. That's different than the sort of organizational governance of the parity compliance program. And that you often see being led by the general counsel's office or the compliance department with like significant technical input from clinical leadership and operational leadership within the departments that are running functions subject to parity. So that's clinical, clinical things like benefit design and coverage. Actuarial is involved, of course. And often you see a committee that is constructed for parity compliance as sort of a subcommittee of the compliance committee. And so you have legal and compliance overall governance, but it can't just be a compliance and legal project because it involves really interrogating and maintaining proof documents about the thinking and exercise of professional judgment among people across the organization.
Absolutely. Well said, Kevin. That is an organizational decision on how they structure that, but you will need a structure. Some places you have different places within the organization departments who are handling different requirements, as Kevin said. So as you look at it within your organization, you need somebody who's going to be managing that because it's a lot to do. Leadership has to be involved as you look forward to going, especially for accreditation and those types of things. But you look at your operations and then you figure out where's the best place for the owner. And then as you develop those committees and you develop those attachments with the different departments that need to provide the information, that's kind of how you put it together.
And Karen, I just want to note on a URAC level, we're not prescriptive about where
Absolutely,
it is.
we are not.
We want it to be there. But as always, with any of our accreditations, health plan, any of those, we say, are you meeting the intent of the standard? We are not expecting it that every organization is going to be in the same place. We are expecting that you are going to show us where it is, how it functions, and that it's effective and is the best for patient care.
Correct.
With that, I really want to thank our presenters again. It was great to be with all of you today. This is such an important topic, and we know we're going to hear and see more of it, this year and in future years. I think the call to action today really is, make sure your organization is prepared for what's coming. And we invite you and hope that you'll take advantage of some of the URAC tools and solutions that we have here to help you. Deanna will follow up with you. We will have a link to this recording and the slides posted to the URAC website in about a week, although those of you who have registered for this webinar will get it by the end of this week. Thanks so much for participating with us today, everybody, and this officially concludes our webinar.